Hi, I am Sangeeta going to introduce you to the topic hypertension. The main objective of this lesson is to understand what exactly hypertension is all about. Our focus will also be on trying to understand the various psychosocial factors that affect hypertension. What is hypertension? Hypertension is a complex, heterogeneous entity with contributions from the genetic as well as the environmental factors. It is also called chronic blood pressure. It has been observed that around 15% of the population generally falls prey to this disease. More so, it is the urban population that is diagnosed with high blood pressure, probably because of their sedentary lifestyles and lack of time for performing any kind of physical activity when compared to the rural counterparts. When a prolonged condition exists in which there is intermittent and chronically elevated blood pressure which is not normal due to any other disorder, then we call it hypertension. This disorder is not noticed as the symptoms do not surface very quickly. However, some symptoms which are apparent include feelings of dizziness and fatigue. So, if at all you hear or you feel that there is a sense of dizziness, it is a sign to get alerted and visit a doctor to get it examined. There may also be insomnia, headache and palpitation of the heart. This condition, if left untreated, will definitely lead to coronary heart disease and at times even become the main cause for death. There are many causal factors in the development of hypertension. First, it is the physiological predisposition. In some people, the sympathetic nervous system is hyperactive and this will lead to greater vascular activity, which will eventually increase the blood pressure of the person. There may be a few emotional factors, especially the emotional arousal that is found to lead to increased stress, which will in turn bring about vasoconstriction, and this will in turn bring about high blood pressure. Researchers suggest that there is a positive relationship between the personality traits and hypertension. They established that chronic feelings of hostility will definitely bring about hypertension. Hypertension is considered to be present in a person if his systolic blood pressure is higher than 140 and diastolic blood pressure is higher than 90. There is the 7th report of the Joint National Committee on Prevention, Detection, Evaluation and Treatment of Hypertension that suggests that all those people that fall under the category of 120 by 80 to 139 by 89 are termed as being in the pre-hypertension condition. This is not a disease category definitely, but those people that fall under this bracket have a high risk of getting hypertension. We will now look into the different types of hypertension. It can basically be classified as essential hypertension and secondary hypertension. Essential hypertension suggests that there is no specific medical cause found in order to explain the condition of a patient. Secondary hypertension suggests that this condition is the result of a disease that already exists in the person. For instance, if the person is a patient of diabetes, there is every chance that he will develop hypertension at some point in time or the other. So, hypertension is basically of two types, essential hypertension and secondary hypertension. Persistent hypertension is considered as one of the risk factors for heart failure, heart attacks, strokes, and this is also considered to be a leading cause for chronic renal failure. What are the causes of hypertension? The causes can be multifactorial. They involve the genetic factors, the biophysiological factors, daily experiences throughout life, interaction between psychosocial factors and stress provoking environments and behavioral choices like diet, exercise and weight regulation. It has been found that hypertension is usually associated with high need for power that a person may have. It also develops due to some kind of anticipated threat. What are the factors for essential hypertension? Essential hypertension is also called the primary hypertension, which has no medical cause at all. Now, let us look into the factors. There may be no specific medical cause, but there are several factors which contribute directly to the condition. Age. With passage of time, the collagen fibers in the arteries and the arterial walls increase, and this results in the blood vessels to become stiff. As there is reduced elasticity in the blood vessels, there is a chance for high blood pressure to develop. Genetics. Hypertension is considered to be one of the most complex disorders that have a great genetic heritability. Insulin resistance. Insulin is a hormone that is secreted by the pancreas. The main purpose is to bring about a regulation in the levels of glucose in the body. When there is insulin resistance in the individuals, there is heightened arterial pressure, and this leads to the condition called hypertension. Next, role of renin. Renin is a kidney enzyme which is secreted by the juxtaglomerular apparatus. This is linked with the hormone aldosterone. High level of renin predisposes a person to hypertension. Salt sensitivity is yet another important factor of a person falling prey to hypertension. Sodium is considered as an environmental factor which received a lot of attention. Around 60% of the patients who are suffering from essential hypertension are highly responsible to the intake of sodium. This is mainly owing to the fact that more amount of salt in the bloodstream will cause more water drawn into the body. This will in turn increase the pressure that is built up on the walls of the blood vessels. What are the factors for secondary hypertension? Secondary hypertension is a condition that comes out because of the existence of a disease earlier. A few people suffer from hypertension because they have an underlying cause. This condition appears suddenly and causes high blood pressure levels when compared to the primary or essential hypertension. Problems related to kidney, problems related to diabetes and problems related to some other medications too trigger off a person's chance to get hypertension. There are numerous risk factors that come along with hypertension. The risk for getting hypertension increases as one progresses in age. It has been seen that race also has a certain amount of significance. It has been seen that the blacks are more prone to hypertension than the whites. Obese people stand higher chances of falling prey to the condition than those people who are in the normal weight category. Physical inactivity, family history, these aspects also are found to make a person more prone to getting hypertension. Consumption of excess salt, smoking habits, consumption of alcohol, all are seen to have a positive relation on the person having a chance to develop hypertension at one point in time or other. High levels of stress also are found to bring about high levels of blood pressure. People may resort to smoking in order to overcome the stress, but eventually they are increasing their own risk of getting hypertension. The various complications that higher blood pressure will bring about can be many. It will definitely lead to heart attack or stroke, it will lead to heart failure, and it will also lead to narrowed blood vessels in the kidneys. There will be thickened and narrowed blood vessels in the eyes also. What is the treatment for hypertension? Well, if it is the secondary type of hypertension, then definitely your doctor is going to be of great help. But what is it that you have to do when your hypertension has been diagnosed as the essential hypertension? Physical exercise. Yes, this is one good mantra that holds good for a whole lot of medical conditions and helps the person lead a healthy life. Increased physical activity has proved that it will lower the blood pressure in the people who are suffering from hypertension. So, try to take just half an hour's time in your activities, daily activities, and this will ensure that the blood pressure levels are maintained at a normal range. However, if you take to gymming, you should ensure that you take lightweight work and do not engage in heavy weight lifting and stuff like that. Dietary changes are also found to bring about a lot of positive effect in managing one's blood pressure levels. Of course, lifestyle changes, giving up smoking, giving up on drinks are found to definitely help the person overcome his hypertension stage. Pharmacotherapy, where the physicians usually take a stepped care approach while they are prescribing medicines to their patients. First weight control, then diet control, and then physical exercise are suggested, and in case none of these have a positive effect on the blood pressure levels of the patient, they will probably then prescribe a low dose of diuretic or a calcium channel blocker or an angiotensin converting enzyme inhibitor. Even then, if the low dosage is not effective, the doctor will then decide to increase the dosage. This continues till the desired level of blood pressure is arrived at. But even when the pharmacotherapy is given, it is strongly recommended that the patients suffering from high blood pressure levels take to relaxation techniques. These techniques can be practiced with the help of an expert, meditation, yoga, hypnosis, biofeedback. All these techniques are found to be helpful in bringing down the blood pressure levels. They are especially useful if individuals with higher initial pressures are unable to overcome their high blood pressure levels. Now, we will look into the various psychosocial factors and hypertension, how these two are related to one another. What could the various psychosocial factors be? These psychosocial factors could be occupational stress, the personality traits, and the socio-economic state of a person. It has been found that all these are related to hypertension, but the relation between each one of them is extremely complex and very difficult to unravel. Different social groups differ in their dietary habits, they differ in their alcohol intake, they differ in their genetic characteristics, and also differ in the prevalence of obesity, all of which may confound any relation between these psychosocial factors and prevalence of hypertension. Furthermore, when a person is seeking help and he is complying with the medical care, he is affected by psychosocial background and a diagnosis of hypertension has been made, this may alter his psychological health. For example, a person is diabetic and then he has been diagnosed as having hypertension too. What will this do to his psychological well-being? First and foremost, he is upset that he has to deal with diabetes. Now there is hypertension also added to the problem. As a result, there is a lot of stress. Now, this stress is again going to add on his blood pressure levels, which will again add on his diabetes management. Therefore, trying to find out the relation between the psychosocial factors is a really very complex one. Patients with hypertension may react to stress differently from those with normal blood pressure. You must have seen quite a number of situations in our day-to-day life itself. A person gets hyperactive when there is some kind of an urgency at home or in the office. Why? Another person in the office is able to handle the situation with great calm and composure. But why is this person unable to tackle it with the same calm and composure? Because this person already has high blood pressure levels. When he is in a stressful situation, he is unable to tackle it like his peer. Hypertension or high blood pressure is a complex disorder of physiological regulation that involves interacting of the biological factors as well as the environmental factors. Extensive research has provided direct as well as indirect support to the fact that the role of psychosocial factors in hypertension is very much significant. Individual differences in the blood pressure and cardiovascular activity to various stimuli and events have been hypothesized as a risk for hypertension. So, we see that a person whose blood pressure levels are high, whose cardiovascular activity is high, will react to stress in one manner when compared to another normal person who does not have a condition called hypertension. This reactivity is associated with the increased activity in the sympathetic nervous system of the person. Repeated instances of reactivity in the predisposed individuals leads to established hypertension. So, when we are saying that a particular person has more risk for getting hypertension, we should also consider the various biological factors that exist in him and also the psychological factors that surround his day-to-day functioning. Researchers have reviewed the literature that is available on blood pressure reactivity and have arrived at these conclusions. There is evidence that there are subsets of individuals that have high blood pressure reactivity than others when compared to a wide variety of stressors. People with a family history of high blood pressure had greater reactivity when compared to those people who did not have a family history. The reactivity in patients who have already developed hypertension may intensify and even accelerate the overall disease process. When interventions are provided at the right time, it will decrease the kind of complications that hypertension may bring in, and it is also found that it will decrease the reactivity levels also and will give a chance to the person to modify the stressors so that he can manage the situation in a controlled manner. This better management will definitely affect the way in which the person can have a control over the progress of the disease in him. As physiological predisposition is one major factor in hypertension, drugs reducing blood pressure are given in medical treatment, but these drugs may have some serious side effects and hence only the right amount of dosage has to be prescribed by the doctor. Biofeedback and relaxation techniques are found to have tremendous influence on the way one could manage their high blood pressures. Unlike the side effects that are a constant feature that come in when the person takes the medical treatment, biofeedback and relaxation techniques do not at all have any kind of side effects. The patients can be trained to lower their blood pressure levels by teaching them the right relaxation techniques. Daily relaxation for around 10 minutes or 15 minutes will spell a lot of magic to one's blood pressure levels. Recent research on relaxation techniques as well as biofeedback only reaffirm the fact that they have a lot of positive influence on the better management of high blood pressure levels. We will now look into personality and coping styles for hypertension. There are anger coping styles, interpersonal conflicts, anxiety, environmental stimuli, all of which might act as stressors for the person and result in high blood pressure levels. There has been a positive relationship established between hypertension and inhibited anger expression and excessive anger expression. A person who gets angry very frequently might definitely test positive for high blood pressure levels. Even if a person does not express his anger overtly, inhibited anger also is found to be contributing greatly towards the person's high blood pressure levels. It has been proposed that psychological treatments or behavioral treatments will definitely improve anger management and also equip the person with better coping styles of his anger. This will in turn improve the ways in which he can manage his blood pressure levels. From the numerous studies that have been reviewed, it has been established that behavioral procedures are found to be effective in reducing blood pressure levels, and they provide the additive benefit that is required when tablets are administered to the patients who are suffering from high blood pressure. Therefore, the right kind of behavioral intervention will definitely in the long run may also see to it that the dosage that has been prescribed for the patient is also reduced, and in some cases when complete control over the blood pressure level is achieved, the person can do away with using the medicine also. To conclude, we see that the causative factors of hypertension are multifactorial, they are complex, and we just cannot single out a particular cause. Effective management of high blood pressure can come about when the person adheres to his medical treatment. At the same time, when it is coupled with psychological treatment in the form of relaxation techniques, biofeedback, or talking to the counselor, it is found that the challenges that are posed by hypertension can be faced bravely and effectively, and there is no necessity that a person who is diagnosed with hypertension develop a pessimistic attitude towards life.